I've seen significant impact. I've seen our peer support specialists help people get out of the house that they've been in for 3, 4, 5, 6 months. Maybe they take one step to meet one of our peers in the community for a cup of coffee. Or they take a step and they allow someone to call them regularly to talk to them. Furthermore, impacts that I've seen is helping people become a little bit more dedicated to their health plans that oftentimes are given to them by medical professionals. We are trained in a concept called motivational interviewing, where we help people make plans based on their own path, based on their own decisions. So, a person might share with us that they have a number of medications to take, yet one of them just makes them feel upset or gives them extreme anxiety. We ask them in a motivational manner if they're willing to talk to their care provider so that that can be addressed. So we help an older adult find their voice to advocate for their own health.
There was a gentleman that I had been working with, and we used to call and text, and that was part of what I did. And I was listening to one of his messages that he left for me on a Saturday afternoon, and he said, "Jen, you're my only friend, and I miss talking to you." And he hadn't called me. I reached out to him a couple of times, and he wouldn't call me back. And then I got a text from him saying, "I don't know what to do anymore," and he had lost his son 6 months prior, and it was really struggling with that. So him saying, "Well, I'm probably going to move. I don't know where I'm going to go yet. Um, Last thing I want to do is go in the hospital again. I'm sick of that." Just the wording, and choices. It was very kind of like gave me that sick feeling in my stomach. Follow that too, because you know them. You get to know them and what their mannerisms and their words mean, or if it's different, their flexion as well in their voice. And I called my boss and said, "I don't know, but he's not admitting to a plan or that he is SI as well. I don't I don't feel comfortable with this anymore. Someone else needs to take over, and you need to know something I believe needs to be done for this person." Being able to identify that I had been there. So I knew almost instinctually, this is wow, I understand that. I grasp that idea. And sometimes you need your meds readjusted. There's so many different options that can help with going there. And the biggest thing is support. The biggest thing is catching them in the sense of catching them to help them. So um, there was there th- it humbled it greatly humbled me, and I was very grateful I had someone to go to as well who could take the reins beyond what I was, my box that I'm in, and capabilities.
One way to help them manage chronic pain is teach them about mindfulness, acceptance, being in the moment, realizing that they cannot do much about it. I've worked with them and I've taught them breathing exercises. There's one that I just learned recently about the square. I think it's two or three breaths in, hold it for 2 or 3 seconds, and then let it go for 2 or 3 seconds, and then start the process all over again in a perfect square. And people can adapt. They can have it be 4 seconds or 2 seconds. It depends on the person.